the establishment of a chain or a group presents the usual issues of change around, establishing identity, getting people to believe in what you're doing and understand what the benefits are. If you don't have a very clear articulation of what it is you're trying to do and why you're trying to do it, it will fail. So we say there are 3 reasons why we're establishing a chain of hospitals. In fact, we don't use the word chain because we think that makes us sound like a supermarket. So we say it's a group, and that all hospitals that come into the group will maintain their own culture and identity, and they'll be serving their own populations. But the 3 key reasons why we're doing it are, firstly, actually there's an economic reason. So it addresses some of the short-term economics. We can consolidate certain services. We can, because we're operating at scale, we can afford the infrastructure to invest in some of the digital technologies we've been talking about, as well as actual fabric infrastructure of things like laboratories. Second reason why we're doing it is because it allows us at scale to address some of the big issues around variations in healthcare. So if you think one of the biggest issues in healthcare provision is there's just too much variation in how we deliver healthcare, how patients experience healthcare, and what their clinical outcomes are. We are starting to make investments in both the digital infrastructure that will allow us to help our clinicians get the data they need to decide what the best practice is, and therefore to standardise their clinical systems around that. So that's a very, very big driver for us, and we believe that there are massive quality and economic benefits from that. The third reason why we're doing this is actually, we talked in the last session around workforce. There, in the UK in particular, but I now understand in Germany and Switzerland as well, there are really big workforce challenges with key staff groups. They don't exist. We have a particular issue in nursing at the moment, but also in groups of physicians, we just don't have enough of them. So it's really important for us to be able to attract and retain really great groups of staff, and so having a scale that's based around a major London teaching hospital is really attractive for our staff, and it allows us to invest in their development, and again give them the digital technologies that they might need to have a more attractive working life. So three reasons why we're doing this. And staying true to those and describing them to people actually helps us make the theory stick and turn it into practice.